morning, sir. My name is Atugonza Shadiah from BA-Con. My registration number is 20/EKD/12455/EV. I'm going to discuss about social insurance on my next slide. Social insurance is a system of government programs that provide protection to individuals and families against economic risks such as unemployment, disability, old age. Yes. So social insurance is all about providing protection to those individuals who are able to meet their economic needs. So it is all about helping such categories of people to make sure they're able to meet such basic needs in life. So these programs are funded through the combination of the government and the employer or employee contribution. So government at this time, government can subsidize a certain percentage and gives in as in a contribution to the employer, which is given to him as a package. Also, it can be funded through the employee contribution, whereby a certain percentage of his salary is cut and it is saved. So for the case of Uganda, we see that we have the NSSF, where the employer his tax and the attachment is put aside, such that in times like when he's going to retire, it's given him as a package. Also, the employee is mandated to pay a certain percentage on behalf of the employee, which is given to the worker as a percentage at the time of his retirement. So I'm going to discuss about features of social insurance. The first point is the mandatory participation. So here under mandatory participation, every individual who is eligible to participates in this program without any discrimination. For now, here what I mean, all those individuals who are supposed to benefit from the program, they have to participate in it without any discrimination, like gender, age, sex, religion. So mandatory participation, like it for the case of Uganda, we say every worker who is working, let it be in the private or government sector, every worker is mandated to is entitled to get that social benefit at the time of retirement. So we have also contributions. Here we see that the contributions are made by the government and the employer and the worker, him or herself, whereby like earlier said, like the contribution where the government contribution, it's where the government comes in to put in to subsidize a certain percentage which is paid to the worker. Then employee contribution is where a certain percentage of the worker is paid in taxes. Then the next is also under contribution. We also have the employer contribution, whereby the employer is mandated to pay a certain percentage as in the NSSF on behalf of the worker. So we have also defined benefits. So defined benefits here we say like every worker has the benefits is has terms and the benefits which are supposed to be made, which are supposed to be given to him without regardless of factors. These contributions are made in factors such as income, age, years of service. For example, here I can give the example of teachers. We say like teachers or any other social worker, but specifically teachers, we see that at the end of their working service, they are given a certain percentage of their work as a package or pension. For example, we say that they receive 3/4 of their salary times the number of service they have been in the field of work. Yes. Then we have eligibility requirements. Yes, this is very true, because we see that these requirements are said that such that every eligible worker gets that social that gets that social benefit. Now, for example, we see that get the social benefit. Now we see that like let him be working in the private or government sector, as long as you work, you're entitled to get the benefit. Also, even if it's not the worker, all those people in the community which need it, as long as they're well identified, they have to be identified very well, and they're entitled to this benefit, regardless of income, age, or disability status. Yeah. So the other issue is the risk sharing. Under social insurance, we see that the contributions are made by different individuals in the community, but okay, it waives that burden of suffering alone. Now, for example, in NSSF, we see that the contributions are made by different individuals, and the benefits are got at different intervals. So, which means like the risk is spread to the whole community, not as a person suffering alone. Yes. Then we have universal coverage. So this is somehow related to eligibility, but universal coverage is all about like including everyone who is supposed to benefit from the program, regardless of factors like age, income, culture, religion, race. As long as that person is entitled to receive the benefit, she receives that benefit. Okay, thank you. That was my first part. Then I'm going to discuss the issues in design of welfare programs. So welfare programs, we see that welfare programs are designed to provide assistance to individuals and families who are in need of financial support. So these individuals or families, see, like for example, we may have the orphans, we have the disabled people, we have the elderly, the unemployed, the underpaid workers. Yes. But however, to give them these social benefits, there are certain principles that should be followed before they are given out. So these are the several issues in the design of these welfare programs. The first one is coverage. So coverage is all about determining who should be covered by a certain program and who should be excluded in a certain program. Now, for example, for the case, let it set the workers, we can see that a certain program can be set to meet to a certain program can be made to compensate some workers, but others are left out. Not only workers, we see like the senior citizens grant which came. Yes, it came only to compensate elder citizens in the country, not any other. No, so if the underage, so you are not entitled to that grant. That's coverage. Then we have eligibility requirements. This is all about determining the benefit levels. Then okay, the benefit levels, since here like we see that eligibility requirements should be set at a certain percentage, whereby eligible requirements are made, and the members who are supposed to benefit from the program benefit from it. Now, for example, like if the program is supposed to benefit the elderly, let it not be strict to restrict them from enjoying their benefits. Or it should again not be too lenient to attract those ones who are not not supposed to benefit from the program, benefit from it. So therefore, eligible requirements should not be set that too high to discourage, to exclude the intended beneficiaries, or they shouldn't be too low to encourage those ones who are not supposed to benefit from the program get a benefit from it. So a balance should be put to ensure that all those who are supposed to get the benefit get it. So we have another thing is the benefit levels. Yes, benefit levels here, I mean like the levels at which the issues the program is going to benefit. So now here under benefit levels, Is that benefit level shouldn't again set it be too low to encourage, like, okay, they shouldn't be too low to discourage work, because like if someone is working, they see like the package is too low, someone will be discouraged from work. All again, they shouldn't set it be too low or lenient to, okay, too low, like to leave individuals and families make ends meet. So a balance should be also put aside to make like the benefit levels, we see they should be set at a maximum whereby individuals who are supposed to benefit from the program make ends meet, like they're able to get the necessary requirements, let's say health, education, like food, shelter. But again, they shouldn't be too high to discourage people from working, or to discourage, yeah, because they see that the benefits is not all that enticing. So on my next slide, the issues in the design of welfare programs. So the next thing is the administrative costs. Administrative costs, these are costs which these are costs which are incurred in the process of running these welfare programs. So we say that this thing, the costs are too significant, because like when the costs are too high, it again makes the program to be expensive and more complex. So administrative costs, okay, the program should be set at a certain percentage where it does not need too much money to be run, but it should be like whereby the necessary individuals are well identified, and they are given their package. So then the next issue is fraud and abuse. Yes, like in any other, like in every other government program, like we said that the people always come in to intervene, and they pretend to, they want to get the benefit, yet they're not entitled to them. So fraud and abuse, we say that welfare program should be set at a certain percentage whereby those individuals who are supposed to benefit from the program benefit from it, and those who are not supposed to benefit from the program, they're excluded. So this will result in not wasting of the taxpayers' income, because like when they're included, we shall see like those who are included yet are not supposed to get to the program, they'll be wasting the other people's money, because they're able to get their basic needs, but they again on the all they also want to benefit from these programs which are meant for certain categories of people. Then the other issue is all about stigma. Yes, we see that most people who okay most people who get these social benefits, they're always lowered by the society. They are regarded as like they can't do anything for themselves. So they should be, okay, this welfare program should be set at a certain percentage whereby these people, the beneficiaries, are not stigmatized by the community where they come from. Yes. So the next issue, I'm going to discuss a case study of social insurance and welfare program, and my case study is going to be in Uganda, and it is the implementation of the Senior Citizens Grant Program. Yes, the Senior Citizens Grant Program was implemented in 2010 with the aim of providing regular cash benefits to vulnerable elder citizens in Uganda. Yeah, this program mainly targeted people at the age of 65 years of age, and these are mainly elder citizens who had reached their retirement age and they can't do anything for themselves. Also, okay, this benefit comes in to help them benefit their okay, to get some basic needs of life, like for example the health care, the food, like upkeep. So like these individuals, they always face with some like health complications, so they give them this money to help them meet their needs. However, however, this program faced some challenges, like the intended beneficiaries, like any other social program in Uganda, where okay, the intended beneficiaries did not benefit from it. Okay, some benefited, but not to its fullest. Okay, but and the also, but to but to mitigate this issue, like the government included the local authorities to make sure like they identify those elder citizens and they are given their money. Therefore, the eligible requirements were entitled to receive a monthly payment of 25,000 Ghana shillings, and this money is unconditional. Therefore, they can receive it without any without any condition. Therefore, elder citizens in Uganda who are well registered, they are well known, they are registered by their local authorities, they are able to receive this money monthly, regardless of the region, the district that they come from. So this program came with this certain positive impacts. That is, according to 2016, like the program helped to improve the status of the elder citizens in the country. For example, they're able to purchase their food and their health care. So this was evaluated in 2016. Then that also this program helps like to help the elder citizens keep with some kind of health care, food, shelter, and therefore that was the main target of the elder program. Since the senior citizen crisis, it mainly targeted the elder citizens in Uganda aged 65 years of age, and they're supposed to receive a monthly transfer of 25 Uganda shillings, that is $7 without any conditions attached. Thank you, sir. That was my part. I remain Atugonza Shadiah. Thank you so much.